Hi everyone. Today we are going to learn about actinomycosis. Actinomycosis is a bacterial disease. It is caused by various species, and these actinomycosis species are gram-positive branching higher bacteria. These are normal commensals of mouth and intestines, and the more important species are Actinomycosis israeli, Actinomycosis viscosus, Actinomycosis mayeri, Actinomycosis odontolyticus. Of all these species, Actinomycosis israeli is more common and it causes a localized disease. Of all these, Actinomycosis mayeri is most likely to cause generalized or disseminated actinomycosis. Actinomycosis have a worldwide distribution. However, it is very rare in the or uncommon in the Western communities. The important thing about this actinomycosis is nowadays we are not seeing most of these actinomycosis cases. That is because of the developed antibiotics and more usage of the antibiotics. This actinomycosis is no longer visible commonly. Coming to the pathogenesis, the critical step in the development of the disease is disruption of the mucosal membrane. Say for example, as we already know, these actinomycosis species or bacteria are commensals of the mouth and intestines and also vaginal tract or genitalia. Whenever the mucous membrane gets damaged due to some other disease like herpes simplex viruses or ulcers or dental hygiene, there will be a disruption of the mucosal membrane. Once the mucosal membrane is disturbed, it establishes and it spreads contiguously in a slow progressive manner. So as these bacteria are commensals in the mouth, whenever there is a disruption of the mucosal membrane, the disease process or bacteria starts to grow inside the cells. And the hallmark of the actinomycosis is chronic indolent phase, manifested by single or multiple indurations. So whenever there is a mucosal disruption, this actinomycosis takes place and it causes indurations. And these indurations may occur in a single or multiple lesions. And when we examine these indurations, we found central necrosis consisting of neutrophils and sulfur granules is virtually diagnostic. So actinomycosis means we have to remember one thing. Sulfur granules is present in the discharge. How do they look like? They look like yellow color particles within the discharge. That is the characteristic feature of the actinomycosis. What are the risk factors for developing the actinomycosis? Pelvic actinomycosis is most common in patients using the intrauterine contraceptive devices. Whenever the patients are using these intrauterine contraceptive devices in female, in a due course of time, they may get dislodged and causes mucosal disruption or damage to the mucous membranes within the uterus, and later that part may develop into more prone for developing the actinomycosis. And patients with HIV disease, because of the decreased immunity, also are prone for this disease. And transplantation patients, say for example kidney transplantation patients or bone marrow transplantation patients, they also are more prone for developing this actinomycosis. And patients who underwent radiation therapy are also at the risk of developing actinomycosis. And there are certain drugs which can cause the disease actinomycosis. Those are infliximab, glucocorticoids, and bisphosphonates. So these are the drugs which can cause decreased immunity and predisposes the patient to develop various infections like actinomycosis. Bisphosphonates are very important because it can cause the tooth damage also. So as a dental doctors, you have to take the history of whether the patient is taking any drugs before going into the actual procedures like extraction or any gingival surgeries when you are doing on the patients. So we have to keep in mind that these are the risk factors to develop the actinomycosis. Coming to the clinical features of this disease, actinomycosis occurs mainly in three forms. What are they? They are cervicofacial actinomycosis, thoracic actinomycosis, and abdominal actinomycosis. Of all these, cervicofacial actinomycosis is the most commonest disease. So, what we should know about this cervicofacial actinomycosis? It is the most common form and it usually occurs following dental infections or extraction of the teeth. And it usually occurs as a chronic and progressive disease. Patients sometimes feel a little pain and induration and localized swelling of the lower part of the mandible. So, the disease manifests as a chronic progressive disease. Usually, it involves the lower part of the jaw or the mandible, and it manifests as an induration or localized swelling. Whenever there is an induration or localized swelling in the parts, usually there will be a regional lymphadenopathy. But in actinomycosis, this localized lymphadenopathy is very rare. And occasionally, the disease may present as an acute inflammation. So, it occurs as an acute inflammation or a chronic process. Chronic process is the most commonest form and acute inflammation may also seen in some of the patients. In a due course of time, what will happen to these indurations? They may form sinuses and tracts with the discharge of the yellow colored sulfur granules. So this is the most commonest form and we have to remember it involves the mandible and it is a chronic progressive disease. So if you see this picture, this patient is suffering with the actinomycosis which is involving the mandible and we see the induration and erythema over the right side of the face. And if you look into this picture, here we see there are multiple indurations with sinuses and some of them are healed and there are many of the lesions. So as we know earlier, actinomycosis occurs in a single induration or multiple indurations. Here we are seeing multiple induration sites with the healing and sinus formation. This is the typical picture we have to suspect whenever a patient comes with a facial swelling or um, swellings with the sinus tracts and discharging granules which are sulfur granules, yellowy color. Let us know about the thoracic actinomycosis. Thoracic actinomycosis usually involves the lungs, and it occurs following the inhalation of the organisms. Normally, healthy lungs cannot inhabit the actinomycosis organisms. But when the lungs are damaged previously due to some other disease like chronic obstructive disease or tuberculosis or fibrosis of the lungs or cavitations within the lungs, these are the patients who are prone for actinomycosis infection. And these patients may develop symptoms such as fever, malaise, chest pain, and hemoptysis also occurs in these patients. And because of the chronic duration of the disease and because of the chronic fever and the presence of the hemoptysis, most oftenly actinomycosis of the lungs or thoracic actinomycosis are mistaken for malignancy and tuberculosis. Sometimes it presents as an empyema which occurs in 25% of the patients. Empyema is nothing but the pus in the pleural cavity. So it is the another form of the actinomycosis. And sometimes there will be chest wall swellings, and these swellings may form a sinuses with the discharge of the sulfur granules. And we have to suspect whenever a patient comes with a long-standing chronic swellings over the chest wall, and these swellings may rupture and form sinuses or tracts, and there will be a sulfur granular discharge from these swellings. And if you were able to see these, we have to suspect that these patients may be suffering with actinomycosis. Well, coming to the third form, the abdominal actinomycosis, most frequently it affects the cecum. So the cecum is nearer to the, it is on the right iliac fossa, and right iliac fossa, whenever we see, we will remember the appendix. And whenever this cecum gets affected with actinomycosis, how will they present? They present with a history of abdominal swelling, and there will be a hard indurated mass is felt in the right iliac fossa. So this mass may in due course ruptures or gives rise to a sinus development. So sinus is nothing but a tract. So these tracts exposed to the environment, and they will discharge the material which contains the sulfur granules. Sorry. As I mentioned, there will be a right iliac fossa mass. The differential diagnosis is malignancy, tuberculosis, or chronic Crohn's disease. These are the important things we have to keep in mind. And pelvic actinomycosis is common with intrauterine devices, which we have known when we are dealing with the risk factors. So intrauterine devices or IUCDs are associated with pelvic actinomycosis. These patients may come with chronic lower abdominal pain and vaginal discharge. Right. So after the clinical manifestations, how will you diagnose? Not only on the history and clinical presentation, we have to confirm the diagnosis. The diagnosis is mainly by microscopic examination of the discharge from the sinuses or indurations and culture of the organisms. We have to do these two tests to confirm the diagnosis. Well, coming to the treatment, how we should treat these patients and what are the drug of choices. Usually, the actinomycosis requires prolonged treatment with high doses of antimicrobial agents. So, this prolonged treatment is also given in tuberculosis. So, tuberculosis, the treatment is for 6 months to 1 year. And here also we have to remember that actinomycosis also requires prolonged treatment. The drug of choice is penicillin and doxycycline. There are other drugs also in use, but the commonest drugs used are penicillin and doxycycline. How much penicillin we have to use and how long we have to use? Usually the dose of penicillin is 3 to 4 million units of penicillin intravenously every 4th hourly. That means approximately for 24 hours we have to use 18 million units. And these 18 million units we give in divided doses every 4th hourly, and we will give this intravenously for 2 to 6 weeks. That is 1.5 months. And following that intravenous administration, we use oral penicillins or amoxicillin for another 6 to 12 months. This duration of the treatment is very important. Otherwise, patient will have repeated attacks or relapses or recurrences of the disease. And how much doxycycline will give? 100 milligrams intravenously or orally 12th hourly for the period of 6 to 12 months. So, important things we have to keep in mind is it requires a prolonged treatment and the drug of choice is penicillin and doxycycline. Penicillin or doxycycline. We can use either one of them.